Hi there, this is Dr. Oishika. I am currently a senior resident in the Department of Radiology at AIIMS, New Delhi. And today I have with me a very special guest, Dr. Oishika.
Hello.
Hi. She happens to be my fiance as well. And she's a gynecologist currently at Maulana Azad Medical College, New Delhi. So she did her post-graduation from PGI Chandigarh, where I also did my post-graduation in radiology. She did her post-graduation in gynecology, and she's a product of LHMC New Delhi. And so in this video, I want to ask her about gynae, OBS and gynae as a branch, because we know that NEET PG and INI CT counseling will start in a few days, and so I wanted to have her insights into this branch. So welcome, Dr. Oishika.
Thank you.
So, so first question I would want to ask you that why should anybody choose gynecology?
We can talk about this in a long-term way and a short-term way. Long-term way being that it is an end branch, it is a heavily paying branch, it is a recession-proof branch, and if you're really down on your luck, if worst comes to worst, what you can do is maybe even run an OPD or open just an obstetrics clinic, and things will get by pretty easily. It is an end branch, that is very important, both a long term and a short term thing that is really helpful, that you don't necessarily have to do an MCH or a DM or even fellowships, because it's a branch that is quite sufficient in itself. But in case you want to specialize and create a niche, then those options are also available. Like there is infertility, there is laparoscopy, there is gyne-oncology, there's fetal medicine, there are plentiful options. If I talk short term, again, it being an end branch, and the other thing that I would really like to point out is, compared to the other subjects, OBGYN is really, academically at least, an easier branch.
Yeah.
So even when you're studying for PG, like the jump between what you study in MBBS versus what you have to study for your PG exams, the jump is quite vast for a lot of subjects, no matter how well you've read them during MBBS. But it is less so for OBS-GYN.
Okay, so yeah, as you pointed out, definitely an end branch and recession-proof branch. Definitely, like India में तो OBS and gynae ना चले ऐसा हो ही नहीं सकता. And third thing is that it is a lighter on your academics. It does not take much as in-depth knowledge and as much reading. For example, in radiology, I'm in radiology, and for me it was a very drastic change from my MBBS knowledge, because we don't get rotated in radiology or get exposed to radiology during MBBS. So yeah, I agree, we are pretty much exposed to gynecology in MBBS. Okay, so another thing a lot of people tell me is that it is a speciality which combines both medicine and surgery. So what is your take on that?
So yeah, that is also a great thing about this branch, that it is not exactly, so it's not even what people are saying, it's even about the degrees that are being awarded. So some colleges are actually awarding MD in obstetrics and gynecology, while others are awarding Master of Surgery in obstetrics and gynecology. So it leans both ways, and that is something that you will see, that dichotomy sort of you will see through your PG years, depending on where you do your PG, and also maybe how you want to or how you choose to lead your life later in practice.
Yeah, for example, I think people who predominantly practice medical gynecology tend to go into infert and practice that. I think very surgically oriented gynecologists tend to do laparoscopy very often and go into gynecology.
Yeah, they can go into oncology, they can go into laparoscopy, they can do that. Infertility also has, it can be whatever you want it to be basically. Even as a specialist in infertility, you can have more procedural gynecology. Infertility does have procedural gynecology, but you can also limit yourself to mainly just endocrinology and be more leaning into medicine rather than surgery.
Okay. So what are the subspecialties of OBS and gynae? So yeah.
So if we talk about it broadly, there is obstetrics, there is gynecology. Within obstetrics, you will you have basic obstetrics. If you really want to specialize into it, then there is high risk obstetrics, there is maternal fetal medicine. So if I talk about OBS, it's basically about these two.
So maternal fetal medicine and high risk ops.
Yeah.
Okay.
So high risk ops will basically deal with all your mothers with medical surgical conditions in which you're sort of trying to look at how these medical surgical disorders are interacting with pregnancy, and because the
For
entire
example, SLE pregnancy or
so the
HIV
entire
pregnancy.
physiology of the body is changing due to pregnancy, the effect of these disorders on pregnancy and the effect of pregnancy on these disorders.
Like heart disease in pregnancy.
Yeah, heart disease in pregnancy. So all of that, it's actually very important. I mean, in India, it's a little difficult because the patient usually comes to you pregnant. But if you have a clientele that is more intelligent with regards to their body, they might even come to you for preconceptional counseling. And you can be a part of a multidisciplinary team with nephrologists and cardiologists and surgeons, and you can take an informed decision for the patient before pregnancy, during pregnancy, and after. So
okay, so in OBS we have high risk pregnancy and maternal and fetal medicine, and so in gynecology, what are the subspecialties?
So I would like to talk a little bit about fetal medicine also,
Alright, yeah.
because it's a really up and coming branch. So fetal medicine is great, and that is something where we really have a lot of interaction with radiologists as well. And we are sort of, like taking away their jobs because we are really because level 2 is basically what OBS, ultrasound is the bread and butter of the radiologist, no matter how fancy you get.
Yeah, but I would like to point out that like the number of people are so much that I don't think any radiologist is complaining about lack of patients. Yeah, so go on.
Yeah, so fetal medicine is something that you can really, when we are looking at the fetus as a patient, which will sound a little strange for those who are not into OBGYN yet but are looking at it, and it's a very lucrative branch, both in terms of how much there is to explore, and also how well paying it is, and what a specialized branch it is. So all that will include, all those, like for example, you have amniocentesis, you have chorionic villus sampling, all those things that you must be studying about right now. There is intrauterine transfusions. There is...
Sorry.
Yeah.
Go on.
So there's a lot going on. So this is a branch of obstetrics that has a lot of interventions in it. But again, if you just want to, be a part of the genetics team and be more a part of the prognostication of diseases in the fetus, then that is also something that you can choose to do.
Okay, so in gynecology, what are the subspecialties then?
So in gynecology right now, we have an MCH in gyne-oncology, and there is also fellowships in laparoscopic gynecology, and there is gyne-endocrinology.
Okay.
And there is infertility as well, of course. So again, depending on what interests you during your PG years and how you envision your life to be later, because like right now, all you guys are pretty young, and that is something that I'll come to later, which is work hours. Yeah, so right now you're pretty young and you're full of energy and you want to do everything, but it's not always going to be like this. So at some point in life, you'll probably want to sit back and really reconsider your choices. And a few branches in gynecology really give you that, that avenue of escape, that fine, I have chosen a very hectic branch for myself, but maybe I can create a niche in this and still have some sort of a lifestyle.
So what are those branches which have a work-life balance in gynecology, in subspecialty?
Yeah, so subspecialties that have a work-life balance in which you won't... so obstetrics, if you go into high-risk obstetrics or even just plain obstetrics, your work-life balance will not be as great, I'd say, as the other branches. For example, if I talk about laparoscopic surgeries or if I talk about infertility, these are basically elective. Like if I talk about my patient care, it's going to be mostly an elective sort of patient care, barring management of certain complications that you might encounter because of your procedure or because of your management.
Yeah, vis-a-vis high-risk obstetrics.
Yeah. Not just high-risk obstetrics, I mean there are always vis-a-vis high-risk obstetrics, of course, yeah. So obstetrics as a whole is something you can't really, be like you've seen a patient through her entire pregnancy and she lands up at your doorstep at 2 a.m., 3 a.m. in the morning with any sort of a problem or a delivery. You cannot turn them away. Yeah. So obstetrics is something that really, like even if it is easy, or if it is not mentally or technically as challenging as a lot of other branches, differs from patient to patient. It is something that will probably not give you a peace of mind with respect to your work hours. So compared to that, if you talk about gynae endocrinology or infertility, these are mostly things that you will do on an OPD basis. And like you're done with the patient, you go back home, you come back again the next day in the OPD. Similarly for laparoscopic surgeries, you post your patients for surgery, do them on a, like an elective basis during day hours, and post-op recovery and everything is also much better in laparoscopy. You also have a lot of daycare patients that can be discharged very same day.
Okay.
So that is something. Gynae oncology, again, elective procedures, but the amount of, from what I have heard, of course, the amount of scut work that you have to do and the amount of hard work that goes into getting that MCH degree is substantial.
Okay.
So that'll add another 3 years to your
training.
Yeah.
Okay, so in OBS, to summarize, in OBS we have high-risk pregnancy and maternal and fetal medicine as specialties, and in gynae we have infertility, gynae endocrinology and laparoscopy.
And gynae oncology.
And gynae oncology as subspecialties. Okay, so in residency first, what are the typical working hours?
So your working hours in residency will actually vary a lot according to what college you're doing your PG from. So I did my post-graduation from PGI Chandigarh, and over there it is, the work hours I'd say are quite relaxed as compared to a lot of other colleges, both through those taken through INI CET and also the ones which you take through NEET PG. Yeah. So PGI has like a blanket rule of, like for all residents that you cannot have 24 hours at a stretch. So that made it very easy for us to restrict our days to, like at a maximum of 14 or 15 hour, work day. But like right now I'm working as a senior resident in Maulana Azad, and before that we had a very intensive training in gynae while I was an undergraduate in Lady Harding, and I did see the postgraduates work over there. So in the ward, the hours can get a little crazy in colleges that you take through NEET PG. For example, right now my first years barely go back home. They probably snatch around 4 to 5 hours of sleep, and I don't know if any meal, if at all. So yeah.
Yeah, that's pretty crazy.
That is pretty crazy. But on the flip side, with these colleges like Maulana Azad and Lady Harding, things tend to get a little better as you grow up, as you go through the postgraduate years, which is not the case in cases of I'd say PGI central institutes, because in central institutes the work is demarcated in terms of patients. This patient is yours, so and so XYZ patients are yours. You take care of everything.
Yeah, from first year to third year, you'll have definite patient.
Exactly. However, in colleges that you will take through NEET PG, usually, there's a very strict, very stringent sort of hierarchy. So it is sort of taken for granted that as you grow up, you have to study and you've done your fair share of, scut work in the first year. So you've earned that right to relax and sort of, grind your first years.
Yeah, I think it was the same in radiology as well for me. I mean, throughout my MD, like the work did not relax as I grew up at the ladder. Okay, so with regards to toxicity in the branch in general, so how do you feel the toxicity in gynecology? So I think most surgical branches tend to be more toxic than medical branches. Yeah. That is there because you really look up to your seniors for the amount of cutting that you get, and you can really be exploited for that. And toxicity, again, it varies a lot according to what institute you're doing your post-graduation from. However, blanket statement, it is going to be toxic. The kind of toxicity is going to vary. Okay.
So there are colleges where you are going to get surgical work. So there the toxicity is going to be different, as in you have to your senior's word is, it's their command and you obey it, and that is the only way to get any surgical hand. So that can get a little toxic because you are at their beck and call all the time, and you really have to, take in that little bit of friendly or unfriendly hazing that comes along with it. However, in central institutes, which is, like where you get an MD obstetrics, it's more of an academic thing, and what really gets to you is a different kind of toxicity wherein you have to balance a lot of academics with rounds where you are hazed on a very regular basis because they are very academic, and you are expected to know everything, and you might be belittled for not knowing XYZ. And
okay, so it varies from place
institute
to
to
place.
institute. Yeah.
Okay, and so like people say that OBGYN is a very satisfying branch. So how do you feel the same?
It is because you are obstetrics, especially because you are taking care of 2 patients at a time, and the thing about obstetrics is that it is. I said it's simple, but it's also very volatile. There is so much potential for things to go very, very wrong in a matter of seconds to minutes. Like from healthy mother going back home with baby, you can have like torrential PPH and patient admitted in the ICU, metabolic acidosis, might die, baby intubated. Like you can have n number of situations in permutation combination. So yeah, to be able to send back a mother, and this happens without a warning. You might think primi gravida, uncomplicated, no comorbidities, but she'll just, if she has to bleed, she'll bleed, and she'll bleed without a warning. So to be able to send your patients back home, 2 patients back home, like it's probably the happiest. OBGYN department is probably the happiest place in the hospital where patients are actually happy. At some point,
at some point,
to have
a kid in your life.
So yeah, like that, it is a satisfying branch, and also in the sense of I can't say the same of gyne-oncology maybe, but for most other bits in obs and gyne, we sort of see the results almost as instantly as we administer the treatment.
Okay.
So we'll either see a failure or we'll see a success.
So
either way, the follow-up is quick. Either way, you'll be satisfied or dissatisfied, and you'll know it fast. You won't keep waiting for results.
Okay. So what are the advances in surgeries that are happening in gynecology? So like people usually say कि obs and gyne was limited to very specific organs, but उस organs में भी what are the advanced surgeries that happen?
So yeah, I mean, OBGYN is kind of limited, like as a surgical branch. Like if I compare it to say maybe surgery or ortho or ENT ophtha, because we really do have limited organs. But even then, robotics has come in, and the advances are mainly with respect to the ease of surgery now. So the entire scene of laparoscopy in India is changing thanks to Dr. Alka Kriplani, erstwhile HOD of AIIMS, New Delhi. And she has also brought in fellowships. There are fellowships all over. And actually, the thing is, not just with gynae, with other surgical branches also, we are really moving towards minimally invasive. And so a lot of open surgeries have become obsolete. So with that, I'd say advanced surgeries like PG level पे तो बहुत स्कोप है एडवांसमेंट का, मतलब जहाँ पे आपको MD डिग्री मिल रही है तो वहाँ से to go into minimally invasive there is a lot of learning curve. So that is there, and also a lot of advances taking place in terms of like medically as well, like protocols for infertility and with respect to interventions in fetal medicine. Like a lot is happening, so you won't get bored. Like for people who want to look for more things, you won't get bored.
All right, so last question, what are the job prospects and salaries of a gynecologist?
So, like I said, recession proof branch, and if you want to create a niche, you can. So, job prospects are endless. The thing is, once you pass out and you do your senior residency or you do your fellowship or MCH or DM, whatever you choose to do, at the end of the day, we have limited options in the sense of either we get assimilated into the government setup or we go into private. Private may either we open our own setup or we go into corporate. So if you want to get assimilated in government, it is very good in terms of work-life balance and also the academics. Then again, work-life balance, I cannot say the same for some central institutes where consultants are not just on call, they live on floor. So, so can't say much about that for some institutes. But yeah, so it'll provide you work-life balance. Plus, for those of you who are academically inclined and want to, keep doing researches and papers, it is much easier to do so in a multidisciplinary setting. For example, a medical institute. And for those of you who are into teaching, so that is again a very good option. For those who are certain that they want to go into private, then again, OBGYN is a great branch to be in because, like I said, you just need a room and a PV table. I mean, and like if you want to start small, and the possibilities don't really end if you want to go big. Corporate hospitals also, I had a very short stint in a corporate hospital as an associate consultant for a very short while. And like they really want gynecologists, and so there's no shortage of job opportunities.
Yeah, even we were looking for jobs post our MD, and I think the maximum jobs were in obs and gynae, and the maximum senior residency posts were also in obs and gynae. And even if there is a small PHC or a small hospital that opens in any city, they definitely have an obs-gynae opening in their hospital.
We are catering to 50% of the population, so yeah, there is never going to be a shortage of jobs for you guys.
Yeah, and I think my mother is a gynecologist, my father is MD medicine, and at one point of time, my mother was earning much more than my father from her gynae practice. And now, though she has reduced her practice a little, but that was the case back then. So yeah, that was about the gynecology and brief questions that I wanted the doctors to know before they chose gynecology. And if you have any questions related to the branch or anything else, you can put that in the comment section, and I'd be happy to respond to it. So I hope you liked the video, and bye bye.